Now history. Uh, History is teenage with diabetes. So and presence with recurrent complaint of recurrent hyperglycemia. So for beginning of the history, we can make the what may be the causes behind it. So the causes behind it may be poor compliance, that poor storage of insulin, non-rotating the site of insulin, and not adjusting the dose of insulin. It may be due to diet, less exercise. And after that, we can consider that puberty, and then infection, and Drawn phenomena, so Moji phenomena. Okay. So, and also we can consider hyperthyroidism and celiac disease in case if it is the case of diabetes with recurrent hyperglycemia. So, in the history, hello, good morning. This is Dr. Roxana, one of doctor working here. Am I speaking to Mrs. Susan, mom of Alif? Thank you for coming. I'm here to take detailed history about Sushan Hill. So, will you please tell me what is your main concern? Sure. Till that he was diagnosed of diabetes. Now there is recurrent episode of hyperglycemia. So, will you please tell me about his diabetes, that when it was diagnosed? So in that, this is a descriptive type of question we are waiting for, and here we will waiting for is she mentioned about the what were the symptoms that time, what was investigation done, and treatment going on, any admission needed. This history for a chronic illness. If during this brief presentation she doesn't mention any of our concern, then we can ask it. So will you please tell me what was the presentation of that time? Can you remember what investigation was done? What treatment is going on? Does she need any kind of hospitalization? How many days? What is the level of the hospitalization? Any ICU hospitalization? ICU admitted or not? And then constitutional symptom. Does she has any kind of fever? Do you have any concern regarding her weight? And what's about her activity? Can you tell me about her sleep? And then systemic review. So now I'm going to ask you the presentation, the symptoms of different types of body parts to make sure that these are present with Alif or not. So in the CNS, we can start from the CNS. So does Alif had any kind of fits, any kind of loss of consciousness? Here we are looking for hypoglycemia may cause convulsion, and Addison disease may be associated with diabetes. So there is loss of consciousness, as well as there may be a headache. And after that, we can ask about the CPS. Does he complain of any palpitation? Do you ever measure his blood pressure? And does he has any kind of cough infection? We are searching for the infection here. And then we can come to the GIT. What's about his poo? And does he complains of any kind of tummy pain for the DKA? And then about detailed history of urination. Do you have any concern about his pee? How many times is it associated? Is it painful or not? And then endocrine history. Does he ever mention about? Do you notice about weather intolerance? Any favorable weather? Any neck swelling? Does she has any skin pigmentation? We are looking for the vitiligo. Addison disease may have skin pigmentation. And then we can ask about does she has any kind of joint pain for orthopathy. And then after systemic review, past illness? Does she has any long extending illness before other than this? Okay, then we will take the detailed history of insulin here. So can you tell me about more details about the insulin? Here we are in her answer, we are looking for the type of the insulin storage, who gave this insulin, does the site is rotated, and where is the storage of this insulin, and any maneuver or method she knows how to compensate if there is excess carbohydrate is intake, how to overcome this, how to calculate this insulin. And then last, does she maintain the insulin diary, last hemoglobin A1C, last blood ketone level, does is how many hypo and the hyperglycemic attack, does she ever do the nocturnal night blood glucose monitoring? This is for the SOMOG effect. Okay, and then does school nurse is involved, and what are the team under his now, and what about the compliance, and did they ever give any concern regarding during the follow-up, and after the past illness perinatal history. So we can ask this because it's not usually so much important. So do you have any concern regarding the period of antenatal before the birth or birth delivery time or after the birth period of Alif? Do you have any concern? And then we can ask about his dietary history, and so which type of meal she prefer, and does she adjust the dose of insulin, and how much exercise she take, and do you have any concern regarding his development, and does because he had a boy, this is the child is a boy, so but we have to ask about the pubertal, and pubertal shaving of the private area. In female we can answer, does she started her menstruation, is it regular or not, and after that the vaccination history, did she receive all of his jabs, and then does she have any kind of allergy to any food, any medication, and then will you please describe your family for me, are you and your partner is blood related, and does in your family any kind of diabetes or any hormone disease in your family, any and then the social history, that what do you do for your living, is it satisfactory, do you need any extra help, and then school history is very important, does school nurse is involved, what's about his school performance, any kind of bullying, and then as it's a teenager, so we have to ask about the head's history, that is the home and relationship, education, activity, and eating and drugs, and this is the eating history, activities, drug, alcohol, tobacco, self harm, depression, sex and relationship. So in home we can ask who lives home with you, and what do you who do you turn when you feels down, and then activity, eating habit we can ask. In education, do you have friend, how is the relationship, and in activity we can ask how do you spend your spare time. In drugs, alcohol, tobacco, in this portion we can ask that it might be personal question, but it's a routine question for teenager. So in your age, lots of people smoke, so do you offer any kinds of cigarette, any kind of drugs, and now and about self harm, depression we can ask that how life is going on Do you ever, what do you do when you are in any kind of stress? And sex and relation, are you seeing anyone very special at this moment? So do you ever had sex? And if female, regarding the contraception. And at the last, what is the impact of this disease in your life? And then make the presentation. So today I took history. Alif is 13 years. He main concern was recurrent attack of hyperglycemia. He had a background history of diabetes mellitus type 1, which was diagnosed 2 years back, and but due to poor compliance of insulin, and also bullying at school, she takes less insulin and sometimes taking overeating, but without adjustment of the dose, and this effect making his more depressed and upgrading his school performance. So this is about the presentation, what was the cause behind this hyperglycemia. And then the question may be, what investigation you would like to do if it is the initial presentation, fasting blood sugar, and 2 hours after breakfast, and then the and first, if the fasting bloods, we will how to make for initial presentation on fasting blood sugar and hemoglobin A1C, and then we will do that thyroid and celiac antibody test, thyroid function test, glutamic acid decarboxylase, Eilers antibody test, and then immunoglobulin A level. And what examination I want to do, the his vitals, airway, breathing, circulation, general examination, for looking for the skin survey, and other examination according to the complaints, and also complaints from the history, and then management plan. So for management plan, if it is acute condition, so we will manage I will establish the patient in acute complication diabetes by presence with hypoglycemia, diabetes ketoacidosis. So if it is, then we will immediately admit the child, but here the presentation is hyperglycemia, so and the patient is stable, so I will review his previous notes, diary, and then I will involve the multidisciplinary team, consultant pediatrician, endocrinologist, dietitian, school nurse, social worker. Sometimes as he is depressed, we have to contact with the school, psychological therapy or counseling may be needed here. And then the insulin regime, this is the insulin the regime management, and intensive educational program where we have to educate the family about diabetics, injection site, how to store this, how to adjust the dose, 6 days rule, and the presentation, the symptoms of hypoglycemia, the symptoms of hyperglycemia, and dietary history, and bracelet support group, keeping in the follow-up. So in follow-up, looking for the long-term complication, which may be nephropathy, retinopathy, neuropathy, hypertension, dyslipidemia. And then what insulin regimen we use, we can use that multiple daily insulin, and this is the basal bolus insulin plus and this regimen includes the long-acting insulin and then multiple injection of the short-acting insulin. And we can also use that short-acting insulin with intermittent acting insulin. Thank you.